All right, I'm
Can
excited.
I ask?
Okay, now we're ready. I was so excited. I got all flustered. So, so what are some of the main points that you'd like to make this year about flu and COVID?
So what we know is that this fall we will have both COVID-19 and flu circulating across the country right here in Michigan. And what we're really concerned about is that people can get ill from the flu and COVID, and we're concerned about our hospital capacity. If we are already dealing with people who may have COVID-19, in addition to people who have the flu, that could really overwhelm our hospital system. So it's something we're really concerned about.
Do you know offhand the statistics for Michigan when it comes to flu, like how many cases we have on average, how many cases get to the hospital on average and how many deaths we might have?
So, what I do know is that the flu is not like the common cold, which is a common misperception. Last year, only about 31% of Michigan residents actually got the flu vaccine. Across the country, 187 children actually died from the flu, and that includes 6 children right here in Michigan. So, what we do know is that the flu vaccine is 40 to 60% effective in preventing the flu. And even if you do get the flu, if you have the vaccine, it can actually make your symptoms be much less severe and make you much less likely to have to go to the hospital or to be in an intensive care unit. So the flu vaccine, it works, it's effective, and it really, even if you get the flu, it decreases the severity of your symptoms.
I know a lot of people are worried about getting it in August because in Michigan, our flu tends to peak in like February or March. And so they're worried about whether or not they're going to be protected that entire time. What's your answer to that question?
That's a great question. So it's really hard to predict when the flu is actually going to peak in any given year, and it changes every year. But you're right, the flu season goes throughout into March and April every year. So it's really important, and we're talking to our medical providers to make sure they're providing and emphasizing the importance of flu vaccine throughout the entire season. And yes, if you do get the vaccine too early August, certainly if you get it in July, you can expect to need an additional flu shot later in the season, perhaps March, because again, the flu does last that long, the flu season.
I know a lot of parents are worried about taking their kids to the doctor to get their vaccinations, and lots of vaccinations on many fronts, not just flu, are down this year because of COVID. What would you say to ease the minds of parents, to encourage getting those flu shots for kids that are going to go back to school in person?
Yeah, I certainly understand. There were two things going on earlier this year. One, just to kind of reserve our clinician capacity, we had to really only let essential, time sensitive procedures happen in our medical community. But also, unfortunately, I think people were scared to come into a hospital or go to a clinic. But I can tell you, both myself, my family members have reached out. We've gotten our own medical care over the past couple of months. They have the right screening procedures in place. People are wearing masks, and they are really, really good at preventing the spread of COVID in their facilities. People absolutely have to. I think it's more of a threat for people getting a vaccine preventable disease at this point than it is for them to get the COVID in these particular facilities that are following these protocols to a T. The masks work, the sanitizing procedures are working, and people should make sure their vaccines are up to date.
Our Spectrum Health has done something really neat where they're doing curbside vaccines. So you can pull up and get it right in the car. You don't even have to leave the car. And I think that hopefully will help encourage more people to want to, get vaccinated. And you're having a press conference tomorrow. Is there anything that you're going to be talking specifics about that you can give us a little teaser on?
Yeah, we'll be talking about the importance of flu vaccine. We've developed some great partnerships with the Michigan Primary Care Association, Michigan Hospital Association. You already noted that Spectrum's doing great things already and being innovative and getting vaccines out into the community. So we'll be talking a little bit more about that.
And this is a really big week in West Michigan for back to school. Many start this week. Most of them are going to, by the end of the week, will have all started. For parents, what would you tell them about schools that are going back in person, or maybe doing that hybrid where it's, one day it's in person, one day it's, virtual, as far as like going back into the schools and just having a little bit of peace of mind?
Right. I mean, I'm a parent of 3 school-age children as well, so I certainly understand what parents are feeling right now. I would say just be incredibly vigilant and talk to your children. Your children are going to be at school without you. Make sure they understand how to properly wear a mask. For younger kids, they can be trained and how to wear a mask for a prolonged period of time. I'm training my second grader so that he understands, yep, it's going to feel a little different, but you can do it. You can breathe in a mask and it's okay. We're just going to be living with masks on. That's just where we are right now. Emphasizing the importance of hand washing and again, making those habits, making those practices, public health practices just become habits. Working very closely with your school systems and your principals, of course, to understand what their policies are and so that you have the most important information about your particular district will be incredibly important as well.
Do you, a lot of parents have concerns that we're going to see an uptick in COVID cases. What are your thoughts on that?
I think if people do the right thing, masks work, hand washing works, social distancing works. If people are doing the right thing in the schools, maintaining those practices, I think we'll be okay. But of course, you're right. We have to watch incredibly closely. I know our schools will. The schools are mandated to report any cases to their local health departments. Our state health department will be working very closely with our local health departments as well. Those smaller class sizes and making sure that classrooms are cohorting, if you will. So a student is not traveling all over the school, but they're staying with a small group of students and not going into different rooms as much as possible. That's going to be important as well to decrease any potential spread of COVID-19 within a school.
So I know in the Southern Hemisphere, it's been noted that there aren't as many flu cases this year. Do you think that had something to do with like social distancing and the hand washing and the wearing of masks, and maybe we'll see a reduction for ourselves for the flu this year?
I certainly hope so. That's certainly promising information, but I think it's too early to really predict what's going to happen here. It's still really important for people to do the hand washing and to get their flu vaccinations.
Well, thanks so much for taking some time. I know you're a busy lady. I appreciate you giving us the opportunity to talk with you, and have a great rest of your day.
Thank you. Thank you for having me on.
It's nice to meet you finally.
Nice to meet you as well. Bye-bye.
Bye-bye.